Welcome to Season 1, Episode 1 of the Netflix original series, The Heart. In today's episode, we will be discussing the chambers and valves of the heart, pulmonary and systemic circulation, chordae tendineae, papillary muscles, and left-sided heart failure. To begin with the circuits of the heart, the human circulatory system is a double circulatory system. It has two separate circuits, pulmonary and systemic, which are arranged in series. That means that one circuit feeds right into the next, and they create what we call an infinity loop because they're intimately connected to one another. In pulmonary circulation, the right side of the heart pumps deoxygenated blood into the pulmonary circulation to the air sacs. In systemic circulation, the left side of the heart pumps oxygenated blood to all the tissues of the body except the air sacs of the lungs. Moving on to the chambers of the heart has four chambers, two upper and two lower chambers. The two upper chambers are the right and left atria, while the two lower chambers are the right and left ventricle. The right atrium receives oxygen-poor blood from the body and pumps it to the right ventricle. The right ventricle pumps the oxygen-poor blood to the lungs. The left atrium receives oxygen-rich blood from the lungs and pumps it to the left ventricle, and the left ventricle pumps the oxygen-rich blood to the body. Think of the heart like a two-story house with four rooms or chambers, separated by strong walls. That would be two atria upstairs and two ventricles downstairs. Blood is pumped through these chambers, aided by four heart valves that act like doorways. The heart is comprised of four major heart valves, starting with the tricuspid valve, also known as the right atrioventricular valve. It has three leaflets and exists between the atria and the ventricles. The tricuspid valve ensures that blood flows from the right atrium to the right ventricle. It also prevents blood from flowing backward between those two chambers. When the right atrium fills and its pressure is higher than the right ventricle, the tricuspid valve opens, letting blood into the right ventricle. Then the right ventricle contracts to send blood to the lung. The tricuspid valve closes tightly so that blood does not go backward into the right atrium. Next, the bicuspid or mitral valve, also known as the left atrioventricular valve, has two leaflets and is located between the left atrium and the left ventricle. The mitral valve allows blood to pass from the left atrium into the left ventricle. It also prevents blood from passing from the left ventricle into the left atrium. When the left atrium fills and the pressure is higher here than it is in the left ventricle, the bicuspid valve opens, letting blood flow into the left ventricle. During ventricular contraction, when the pressure in the left ventricle is higher than it is in the left atrium, the bicuspid valve closes tightly to prevent backflow of blood into the left atrium. On the left outflow tract lies the aortic valve, which has three semilunar leaflets that capture the blood as it tries to flow back into the left ventricle, and that causes them to close. On the right outflow tract lies the pulmonary valve. It also has three leaflets and has cusps that are C-shaped, and it will capture the blood as it tries to flow back into the right ventricle. Think of the heart valves as a hose bib. Hose bibs usually contain something called a vacuum breaker, which is a backflow preventer. It prevents water from flowing backwards into the plumbing. Heart valves perform the same function. These valves are really here to provide a means of ensuring that blood flows in only one direction through the heart. If it flowed in the opposite direction, you would get no forward flow out to your tissues like your lungs or the rest of your body.
Deoxygenated blood from the systemic circulation returns to the right atrium via the superior and inferior vena cava and the coronary sinus. The blood in the right atrium flows into the right ventricle through the right atrioventricular valve, also known as the tricuspid valve, during diastole. During systole, the right ventricle contracts, directing blood into the pulmonary trunk. Contraction of the ventricle causes the tricuspid valve to close, preventing backflow of blood into the right atrium. You also have the pulmonary valve between the right ventricle and the pulmonary trunk, which closes during diastole, since the pressure in the right ventricle is less than the pressure in the pulmonary trunk, and this is to prevent backflow of blood. Oxygenated blood from the lungs enters the left atrium from the pulmonary circulation via the pulmonary veins. During diastole, blood passes from the left atrium to the left ventricle through the left atrioventricular valve, also known as the bicuspid valve. Contraction of the ventricle causes the bicuspid valve to close, preventing backflow of blood into the left atrium. In systole, the left ventricle contracts, forcing blood into the aorta. Once again, you have an aortic valve between the left ventricle and aorta, which prevents backflow of blood during diastole, when the ventricular pressure is lower than the pressure in the aorta. From the aorta, the blood divides into separate streams, entering progressively smaller systemic arteries that carry it to all the organs throughout the body, except for the alveoli of the lungs, because these are supplied by the pulmonary circulation.
What are chordae tendineae? Which valves are fitted with the chordae tendineae and why? The chordae tendineae is a tendon structure that looks like strings, which are made up of thin strands of connective tissue that extend from the free edge of the cusps of the atrioventricular valves, which are the tricuspid and mitral valves, to the apices of the papillary muscles within the right and left ventricles, respectively. They help keep the valves closed during the systolic phase of the ventricles, which is the contraction of ventricles, by holding the cusps of each valve in place. When the ventricles contract, pressure gradients across the valves pull the cusps of the mitral and tricuspid valves shut. This helps prevent the backflow of the blood from the ventricle to the atrium, which ensures blood to flow in one direction only. What effect would damage to the papillary muscle in the left ventricle have on blood flow through the left side of the heart? So the papillary muscles serve as a protective wall for the atrioventricular valves on both left and right sides of the heart. These muscles are connected to the valves through the chordae tendineae, which helps prevent collapse or breakdown of the valves, which are known as prolapse. When these muscles work properly, they help prevent the blood flow from being forced back into the atrium through the atrioventricular valves. This backflow is known as a valve regurgitation and can lead to left or right-sided heart failure. In this scenario, the left ventricle papillary muscle or submitral valve apparatus muscles are damaged. As a result, we will have a mitral valve prolapse, which causes backflow of blood from the left ventricle to the left atrium during the systolic phase of the ventricles. This leads to left side heart failure, which will cause decrease in the blood volume that is pumped by the left ventricle, that subsequently lead to decrease in the volume of oxygenated blood circulated from the left side to the whole body. As a result, this can lead to hypoxia, pulmonary edema, which is excess fluid in the lung tissue, and acute ruptures of papillary muscles frequently result in severe mitral valve regurgitation and subsequent acute life-threatening cardiogenic shock. Next, I just wanted to talk about the causes of papillary muscle damage. So we would have myocardial infarction, fibrosis of heart muscles due to decreased blood flow to the heart muscle, which is stenosis of coronary arteries, or an infective endocarditis, which is often bacterial. Symptoms of left side heart failure, so decrease in the blood volume ejected by the left ventricle, decrease in blood pressure, so patients might feel dizziness, lightheaded, hypoxia, decrease of oxygen level in the blood, some patients might feel or look blue, shortness of breath, excessive fluid in the lung, which is pulmonary edema, and acute cases of mitral valve prolapse leads to cardiogenic shock.